Let's see. Yes, okay, perfect. So my name is Leah. Those of you that are here, thank you for coming in. Thank you for coming in on the Zoom. My name is Leah. I am one of the embedded tutors for anatomy and physiology. More so, I'm embedded in Mr. Torres's anatomy classes. So what that means is I sit in on all of his lectures, his labs. I take all the notes the students take. If they have any questions during the lab section, then I'm in there answering questions for them, looking at models with the students. We offer a really nice resource in the Science Learning Center in that while I'm in the lab, I'm kind of getting a sense of the types of questions that will be asked on the exam, both for lecture and lab. I'm curating practice lab exams and practice lecture exams. And then we also have most of the models that you guys look at in the lab. So we're just a really good resource to have. Our hours are posted on all of the doors in Frio 111. And if you are one of the online sections, then our hours are also online. See if this works. There we go. Okay. So first, some expectations in anatomy and physiology. There's two components to the course. 1 and 2 are very demanding courses that require time, effort, and hours of preparation. Many students who have been in college before and they're taking the course in a later semester, they sometimes have gotten into a habit of studying the night before or starting to study like 2 days before. This is not the type of course in which you can do that. This is the type of course that you need to study a little bit every day, and then you might still not even be prepared for the exam. So you really need to learn study habits that work best for you coming into the lab, just kind of trying out different things for your brain that will help you succeed. So again, this is not just a lecture course, but there's also a lab component that makes up a large chunk of your overall grade. So unfortunately, you do have to put the same amount of effort into both components of the class because they both make up a very heavy portion of your grade. So we're going to talk a little bit about understanding the subject. So as the course name entails, anatomy and physiology. Anatomy is the study of the structure of the body and its parts. So a lot of the models that we see, we're just looking at the anatomy of the human body, not really the physiology, but more the anatomy of it. Anatomy also focuses on how organs, tissues, and the systems are organized. So we have the skeletal system, we have the endocrine system, we have different systems within our body. All of this is the anatomy. And then physiology is the study of the function of the body structures. So physiology focuses on how organs and systems work together to maintain life and health. So in, for example, Anatomy 1, right now we just covered homeostasis, so keeping our body in equilibrium. Physiology is more so studying how the body keeps itself running. It's important to understand the difference between the two because it comes into play in both the lab and the lecture. In the lab, a lot of the time we're only looking at the anatomy, and then in the lecture, we're looking at the physiology. So just understanding what you need to be studying for both the lecture and the lab. And then why are anatomy and physiology important separately? These are both crucial for understanding how the body works in health and disease and forms the foundation for many health-related careers, so medicine, nursing, physical therapy. I know I talked to someone earlier who was going or trying to go to the dental hygienist route. So there's a lot of different careers that need anatomy and physiology. And it is a prereq for most medical programs that we have here. So getting into some study strategies, like I said earlier, you're going to want to study a little bit every day. So each week leading up to the exam, study a chapter. It should be that each of the exams covers 4 chapters, so that would be 1 unit. So this first unit, I believe, is chapters 1 through 4. So I know we are already in week 2 of classes, but an example of how to study is taking 1 chapter, and there's little subunits in each of the chapter, doing 1 of those a day. Some are shorter than others, and there's some chapters that have like 17 subunits, so it may take a little longer to get through that, but that's definitely one way that you can achieve studying, and especially if some of the subunits are a little bit easier than what comes later in the chapter, you can definitely knock out a few of those and then spend more time on the harder subjects. So with anatomy in the lab, this is more so for the lab, you're going to want to know the structure, the location of the structure, the purpose of it, and then other structures that it may work with within the body. So this can go for the skeletal system. What else do we cover in A&P 1? Muscular system, things like that. Next, you're going to want to start using scientific terms in your everyday being. So superior, inferior, laterally, medially, things like that. Just getting used to using that language is really going to help you study. Breaking things down, it will help you study. And then once you get to the exam, you don't have a lot of time to stop and think about it. So definitely using that will help you kind of get the answer right away on the exam. One of the most important and easiest things to do is participate in class and lab. And the first step in doing that is just showing up, asking questions, taking diligent notes, especially if you're in one of the courses that has an embedded tutor. That's what they're there for, is to really help you out. A lot of the professors put their own notes on, what is it called, Canvas. So if you need help finding that, you can come in and see me, or we can look at it here. But they have their own notes, and I really think that's like the skeleton of the chapter that you're covering. So those are really good resources to use. For the lab practical exam specifically, you're gonna want to come in the lab and see the models beforehand. If you show up to the lab exam having not attended one lab or maybe even 2 or 3 labs, and then you go and try and take the exam, you're seeing that model for the first time, and it will not look like the pictures online. So you're definitely going to want to come in, be familiar with the models that are in the lab. A lot of students like to take pictures with their phone or their iPad and then use like another app to write out what they're seeing or label it. What I like to do, and what I like for students to do when they're in here, the Science Learning Center, I like for them to grab models, and we have colored tape that they tear, write down what they're looking at. So if we're looking at the cell, which we will cover in a few weeks, they will write down, nucleus, ribosomes, mitochondria, tear that, and then label it. So then when they get to the lab exam, they've already seen the model that will be on the exam, and then they already kind of have that like kinesthetic labeling. So once they see it on the exam, they already know, hey, I've seen that before, I've labeled it, and then they know what to write down. Another good study strategy is making yourself the patient. So we did just talk about anatomical position in lab. You are always the perfect patient because you are already in anatomical position, especially right now that we're just covering the quadrants and regions. That will be really helpful, especially on the exam. You do not have any cheat sheets. You don't have anything that's on the wall that will help you in figuring out the answer, but you already have the answers on yourself. And then down below, I have some helpful apps that I have seen students use. They're helpful. I believe most of the ones on the bottom are free. Those are just helpful when we get to like the skeleton and muscle tissues, because you can like pull back layers of the skin and identify where it's at. This is especially helpful when you're at home and you don't have access to all of the models. And then there's another app that's new. It's this 3B Smart Anatomy app. 3B is the brand of some of the models that we have here. So if you see any of the models in lab and they have like a tag with a QR code on it, if you scan it, you can open up the app on your phone, and it will take the model and put it in your phone, and then you're able to look at the model while you're at home. So it's basically like having the model in the lab at home. And the next part of anatomy is really mastering the terminology. So everybody studies differently. I'm someone, and I like to create like little songs or mnemonics that help me remember things, because if not, it just goes over my head. So with anatomy and physiology, a lot of the terms come from Greek or Latin roots. This can be difficult, especially for someone like me, where I only speak one language, English, and so a lot of the times I have to kind of decode what we're talking about. So learning common prefixes and suffixes to help decode unfamiliar terms. So cardio referring to the heart, itis, inflammation, osteo referring to bone, things like that. Same idea, breaking down the complex terms into smaller parts to understand their meanings: osteo, bone, arthritis, inflammation, and this goes for a lot of the things that we will study in lab. Number 2, using mnemonics, so creating memory aids to remember terms and processes. Again, however you decide to study is that your own way to study. In the lab, in while you're taking an exam, if you have to stop and write down letters or write down like a tic-tac-toe board to remember the regions, do that. So here's an example of a mnemonic. It's the one that has all the S's, the M's, and the B's. It kind of looks like it's just jibber jabber and doesn't mean anything, but this is actually the functions of the cranial nerves. So it's: some say marry money, but my brother says big brains matter more. That's sensory, motor, both, sensory, both, and motor. And so those are part of the cranial nerves. Another one that I like is tiger cubs need milk with the C. These are the bones of the foot. So the talus, calcaneus, navicular, medial, intermediate, lateral, cuneiform. And I am filled with like quirky mnemonics. Sometimes when I don't know one, I'll just look one up, ChatGPT it, because this is how my brain remembers things. Your brain might not, but this is how, this is what helps me remember bones, muscles, things like that. Another good tip is reviewing the terminology. So if you have not looked that far ahead, your final is cumulative. So you have, I believe it's 5 lecture exams and then your final. So everything on the first exam will be whatever the first 4 chapters covered were. The next exam will cover the next chapters, but once you get to that final exam, everything comes back around. So making sure you're consistently reviewing old things, quizzing yourself on terminology. A lot of students like flashcards and apps like Quizlet to help you reinforce terms. I'm not big on that. I'm a writer, so I need to write something down to remember it, but everyone is different. Practicing with real-world examples, again, using anatomical examples to connect terms with their functions. So bicep brachii helps in understanding its function. Specifically, it flexes the elbow and helps in lifting objects. By associating the term with its action, bending the arm, it becomes easier to remember both the structure and its purpose. Again, the best way to study for anatomy is to use yourself. My favorite example is when we're studying like the bones. Whenever you're learning one, try to find it on yourself. I remember the first time I was learning the lower leg bones, the tibia, I was so freaked out with like being able to feel my shin and knowing what part of the tibia that was. So using yourself is really helpful. And again, you're already in anatomical position. So your left will be the left that is on the lab. For example, if you have a bone on the lab exam that you need to identify and it's a humerus and they say identify which side of the body this comes from, being able to know that it's from your left side, you can hold it up to your left side. That will help you out. Okay, and then visualization and active learning. The best way to study for the lab practicals is getting in here and looking at the models. Spend some time in the lab looking at models, then come into the Science Learning Center to label, draw, and look closer at different models. What a lot of students also do is print out specific pictures of, it can be of the bones, of muscles. Right now we're doing, regions. So what they do is print those out and then come in here and get like a clear, what are they called? Paper protector, and then just write on that with Expo, erase it, and then do it all over again. Videos and interactive tools. So I'm someone who, when I don't understand something, I have to break it down to like an elementary level and then work my way up from there. So for example, we'll be covering mitosis pretty soon. It's not too difficult, but that is something that some students have a lot of trouble with. So what I always suggest is finding like a really 3rd grade explanation of mitosis and then working your way up. Interactive websites and videos. So we have 2 that I'm going to show you how to use in a bit. These are Physio Playground and PAL. Physio Playground is in our Canvas page, and PAL comes with your ebook. So again, I'm going to show you how to do that in a bit. Hands-on learning, participate in labs, dissections, or virtual dissection tools to engage with real-world anatomy. A lot of the professors do things differently. Some professors lecture during labs, some have you actually doing the lab activities. It just kind of depends what your professor wants you to do. And then using the models or hands-on exercises will help reinforce your learning. So an example of this is understanding that the glenoid fossa of the scapula is important to the shoulder joint, but where is it? Can you spell it? Are you aware what the function of it is? Remember, on the exam, there are no word banks, so you really need to know how to identify something and then how to spell it and what its function is. And then lastly, use our resources. We have a lot to offer. We have reviews, practice lecture, and lab exams, models, study tools. We have textbooks that you can use while you're in here. We have the practice atlases. We have the whiteboards. We have the printed out pictures with the paper protector frames that you can write on. So please come see us. We have a lot of resources for your success. And then another big issue is time management. So I think a lot of students just try to go into studying and they'll say, okay, I'll finish this chapter and then I'll be done. But you really need to create a study schedule for anatomy. This is not something that you want to just go into without a plan. So definitely plan your study sessions in advance. And like I said, break down the material into different chunks. So breaking down chapter 1 into 1.1 on Wednesday or Monday, 1.2 and 1.3 on Tuesday, and then so on and so forth. You'll also want to include some time for review. In your e-textbook, there's also practice quizzes and chapter tests that I do recommend you do. I do not believe they pull test questions from there, but it's good to test your knowledge and see what you may need to study some more. And then an example of this is study for 30 minutes, take a 5 or 10-minute break, but then after that break is done, jump right back into it. I know it's really tempting to just stop after that, but you definitely want to keep studying. You should be studying, I think it's like 3 hours a day, or is it 1 hour a day per 3-hour course? Mr. Torres suggests studying like 15 hours a week for A&P 1. So that sounds like a lot, but when you break it down, if you come in here and you study 2 hours between classes and then you go home and study for an hour, there's your 3 hours for the day. Prioritize the difficult topics, so tackle challenging material early in your study session when your mind is fresh. In anatomy, we do cover chemistry. I'll say it. Chemistry is not my strong suit. It is not something I thrive in. So that is definitely something that I would have to cover first, spend a lot of time on. I know I would probably become frustrated with it, but then take some time, a step away from it, and then come back to some of the easier topics. And then again, use active learning. So practice questions. Maybe if you're working in a group, teach the subject to one of your friends. Maybe they're not understanding it for difficult topics, or come in and see us. The third thing, try to avoid cramming. This is probably the worst thing you could do because there's so much information, there's so many definitions and different terminology. If you just try to do it all the night before or even a couple nights before, it would not work out best in your favor. Spread out your study sessions over time. Cramming the night before an exam leads to short-term recall rather than deep understanding, which again, you'll need to remember everything, kind of have that knowledge for the exam, the final exam. It does come back around. Set specific goals for each study section. So have clear objectives for what you want to achieve in a specific study block. So let's say you're going to study for 45 minutes and then take a 15-minute break. During those 45 minutes, try to master the circulatory system, or let's say memorizing the bones of the leg in those 45 minutes. Then take your 15-minute break and then try to study something else. Another thing with anatomy is, especially when we get to the bones, once you kind of learn one side of the body, then you already know the other, because you know we have 2 humeruses in our body. We have one right and one left. So that goes for a lot of the bones. Same thing with the muscles. Try to minimize distractions. I know it's kind of hard. The Science Learning Center is usually quiet. I will say when we get to exam week, we definitely have more people coming in at a time. And then especially right before an exam, like if your exam is at 11 o'clock, we're usually pretty packed by about 10:15. So right now is a perfect time to come into the SLC. We're quiet. We have resources for you. And then regular breaks and self-care. Take short breaks to refresh your mind and avoid burnout. If one specific topic is really boggling you, seek out tutoring, extra resources. We do offer Zoom appointments. You can do those in Navigate. If you need help figuring that out, you can email one of us and we can set up an appointment for you. But definitely don't try to understand a subject if you're just really not getting it. Seek out other resources and then try to come back to it. And that's it. These are our resources for success. I'm going to go through a few of them with you, but these are just some that are here. So we do have our Canvas page. If you are not yet on there, you should have received an invite. If you haven't, please let us know. We have most of the images that are in your lab worksheets are in that Canvas page, and they're blank, and then they have the answers to them. So if you need to check your work, if you want a blank page to study or write on, those are there. We have Gale, which is the physio playground. I'm going to show you how to access that in a little bit. The atlas is available in the bookstore, and it's free to you as PAC students. You just need to go pick it up in the bookstore and then return it at the end of the semester. This is really helpful for when we get to bones and muscle tissue and also histology. So these are really helpful, especially when you're at home studying and you don't have the specific models in front of you. We also have the hard copy textbooks available in here. I don't like having to flip back and forth between like Word and our e-textbook or Googling something and then having to go back to the textbook. So definitely when you're in here, the hard copy textbooks are a great resource. The anatomy coloring book is also free. That's in the Canvas page. This is helpful for the lab portion of the course. We have practice exams. There's also PAL, which I believe is something anatomy lab found within your ebook. I'm going to do like a quick tutorial of how to get to it, but if you're still having trouble, you can come see me. And then we also have microscopes in the lab with slides that are already prepared for you. And we have everything that you will see on the lab exam in here. And yeah, so I'm going to do a quick tutorial on how to get to Gale Physio Playground, and I believe it's MyPal or PAL. We also have a tutoring and YouTube page. So if you're watching this now, probably on YouTube, then you found us. But definitely follow us on Instagram. It's pack_tutoring. We post when we're going to have like workshops, review sessions, our hours. And then I also have our hours here of the entire lab. So we're open 8 to 5:30 Monday through Thursday, and on Fridays from 8 to 1. And now we are going to go through how to find specific things on Canvas. So I'm going to first start with the anatomy tutoring program page. Okay, this is what yours should look like. I'm going to scroll down to modules. And we have resources for all 4 lab exams, and then also A&P 2, which you guys do not need to look at yet. But like I was talking about, the A&P 1 lab practical one, if I click on anterior body landmarks, it's loading. This specific image is showing up on the exam. A lot of students print this out and then they'll go in by themselves and label it. The good thing about this is it's already labeled on the bottom. So if you need to check yourself, if you're unsure, if you don't have access to the book, here this is for you. And we have, let's see, anterior body landmarks, the body planes, posterior body landmarks. Most of these images that we do have will show up on the lab exam. And then we also have the anatomy coloring book. This is a free download. Here is the, let's see, yeah. So orientation, skeletal system, everything you need. Let's just click on a random page and here we go. So I like this because it tells you exactly what you're coloring. And it will really break it down to you, even giving you information about specific parts of the bone or exactly what you're coloring. We also have Physio Playground. This is another useful resource. I like this one because you can zoom in and remove layers. And then you can see deeper into exactly what you're looking at. And then if you hold on to it, it will tell you what you're grabbing. So let's see if we scroll down here. You can move it to expose behind it, and it tells you what you're looking at. So this is also another good resource, and it has different subjects that we will cover. And this is all in the PAC Anatomy Tutoring Program Canvas shell. If you're not yet in it, you should have received an invite. If not, please let us know and we can add you. And now I'm going to show you how to access the practice anatomy lab. So you'll click on your specific section, and this might be different for different professors. This is for Mr. Torres's courses. Click on modules. Here is your e-text for the course. Underneath it is the mastering study area. And so here we have, again, the practice tests and quizzes. So chapter quiz, right now we're on chapter 1. And these are the types of questions that you can expect on the exam, not the same exact questions, but the types of questions. And it goes all the way until A&P 2. And then what I want to show you guys is the practice anatomy lab. You'll have to launch. And it has all of the different units or sections that we look at. So next lab exam 2 will cover the, what are they called? Bones. So we just click on any of these and it tells you exactly what you're looking at. So here we're looking at the sternum, clavicle, and then you can change it. So if you want a different view, this one takes a while. Here is the cranium. You can click on it and get even closer, and it'll tell you the specific parts. So here's the manubrium of the sternum. You can get different views. Oop. Oh, no, not that. You can turn the model, click on specific regions, and it tells you exactly what you need to know. And then another good useful tool is histology, because you obviously won't have the slides at home. A lot of students like to take pictures of the slides, but it's really not easy to get a really good picture of the slides. So here we have areolar connective tissue, mast cells, adipose, and this is what it would look like on your lab exam. It's always going to be super obvious what they're trying to get you to identify. So this is a really good tool in being able to study histology at home. And then I'm going to go back to this page because there was something else I wanted to show you, but now I forgot. Oh, here it is. Okay. Another resource that students like to use is the art labeling activities. I'm going to scroll down to chapter 7. And it is just really helpful for labeling specific parts of the skull. There's also the arm bones, there's some leg bones. It's super helpful when we get to the muscles because it breaks it down into separate categories. With this, a lot of the students will only print this specific part here. And then again, they'll use a clear protective sheet and an expo marker and label that. This specific image either shows up on the exam or are like the skulls that we have in our lab, and they're colored the same. And so that's really helpful in already seeing the material beforehand. Yeah, I think those are all of the resources that I wanted to show you guys. If you have any questions, please let me know. You can put them in the chat. Or if you want to come in and get like a one-on-one tutorial or some feedback on how you should be studying, please come see us in Frio 111. Thank you.